Imagine that your brain's power suddenly switches and flips off. Now, that is what stroke feels like. A stroke can happen fast and without notice. So let us break down the basics. What is stroke? Stroke is a lack of blood flow to the brain that results in the loss of neurological function. There are three types of stroke. We have the ischemic stroke, the hemorrhagic stroke, and the transient ischemic attack. Now, ischemic stroke is usually caused by blood clots that obstructs blood flow to the brain and results in stroke. It can either be thrombotic, which means that this blood clot formed in an artery in the brain, or it can be embolic, which means that the clot travels from another part of the body to the brain. Now, the second type of stroke is the hemorrhagic stroke, which is caused by bleeding. This bleeding causes increased intracranial pressure that causes obstruction of blood flow to the brain. It can either be intracerebral or subarachnoid. Now, the intracerebral is when there's bleeding within the brain, and it can be caused by uncontrolled hypertension. Now, the subarachnoid occurs between the brain and the spinal cord, and it is usually caused by aneurysm, which is the rupture of a weakened artery. Now, the third type of stroke is the transient ischemic attack, which is also called the mini or the warning stroke. It is a stroke that usually lasts for 1 hour. It also has the same pathology as the other types of stroke. Now, it is important to remember, ischemic is for clots, hemorrhagic is for bleed, while the transient ischemic attack is a mini warning. All these can either be silent or sudden. So it is important to know these basics, types, and their differences, because this knowledge can save a life. Thank you and bye.